What's going on, everyone? Happy Friday. Hopefully, everyone is doing well, staying safe, healthy. If you had to take a COVID test, flu test, RSV, maybe some other virus, I hope you have tested negative. If you did test positive for any of the viruses, or maybe you didn't test positive but you're feeling sick, I hope you have a full and speedy recovery with no long-term and no long COVID issues. It is time now for the Friday edition of the Virus Update for Friday, January 17th, 2025. If you are new to my channel, welcome to my channel. This is where I do daily virus updates as needed on all those viruses making people sick. Maybe you clicked onto this video because you're sick. You're not alone. There's a lot of people sick right now. There's illness outbreaks, COVID, flu, RSV, pneumonia, norovirus, and other viruses are all in high circulation right now, and we do have news stories and new data today showing just what the levels are of those viruses right now. And I can tell you this much. If you may have heard, oh, it's going to be no big deal this year, and maybe they were referring to COVID, well, it doesn't matter. All the viruses put together into a pot, making virus soup, are a big deal this year. You might have seen the headline that we're going to start off with. Yeah, a school with 500 students absent. That is a big deal, and anytime we get that during the winter, they happen pretty much almost every winter now that we're in the COVID era. It is a big deal, especially if you're sick right now and you can't go to work. That's a big deal. If you know someone who passed away from one of the viruses this winter, that's a big deal. You get my point. So, want to stay informed with what's going on? Hit that subscribe button down below. I'm trying to hit 10,000 subscribers by the end of this year. I think we can do it. Just keep sharing this video with anyone you know. Leave your comments down below. Hit that notification bell. And another way to help me out is if you like the video, give it a thumbs up. Let's try for 200 like button hits today. Alrighty, starting off in Oklahoma with the news. We do have a lot of news stories, plus a surprise. CDC did update. I'm really surprised about this. CDC did update some of the data today, including variant data. We haven't had variant data in weeks, but some of the updates from the CDC just don't make sense. I'll explain. Let's get through these news stories first. Ponca City Schools in Oklahoma closed due to illness. Over 500 students are absent. And you're probably wondering, okay, that's a lot. What's the size of the school? Well, according to PCPS, more than 500 of the 1,412 students, I'm guessing that's the size of the district, were absent. That's a big number. And they're going to do a virtual day on Friday. This includes staff and teachers. If you're sick, I don't know how virtual's going to work for you. Are you feeling up to it? Will you be able to pay attention? I don't know. It sounds like one big mess, if you ask me. Big deal for that school district. Now let's go over to, I believe, Wisconsin. Yes, I was just alerted to this one just about 10 minutes before doing my update. Thank you to the person who alerted me to this. Adams Friendship Area School District cancels classes for Friday. This is because they have a large number of people, once again, students and teachers that are sick at this time. And because of that, they just cannot go forward with school today. Then we go over to higher education, a university. Clemson University is reporting a surge in flu cases on campus. Yes, this is not good. And it looks like, mind you, some of these news stories, we're going to be seeing data that stems from last week's CDC update. But Clemson University has seen an increase in flu cases in South Carolina. And South Carolina in general, from January 5th to the 11th, 3,230 positive cases for flu so far this season, 14,443. And again, that is as of the previous CDC update. That is likely a higher number as of today because the CDC did update for today. Flu and respiratory illnesses seeing high activity in southern Nevada. This is not good. So Nevada is seeing an increase in the number of flu, and it says particularly flu hospitalizations has seen a sharp uptick. Last season around this time, flu hospitalizations were at 294, and now they're nearly 50% higher at 438. That is not good whatsoever. Taking a look at this, we're going back to South Carolina once again. 3 hospital systems in upstate will tighten visitor restrictions as of Friday because, hey, they are seeing an increased number of respiratory illnesses in the health system. So if you're going to visit a patient, maybe you're not feeling well, fever, cough, sore throat, or you're positive for one of the viruses, sorry, you cannot go and visit a patient at this time. They're trying to limit the spread of the viruses in healthcare system already. Take a look at this. In Hawaii, and this actually, I didn't include a study in here, but this would actually bring up a really good reminder. Let me explain. Hawaii is reporting, and here's how the article headline goes. Busiest flu season as respiratory illness spread. Hospitals are seeing a rise in patients with common illnesses. Healthcare experts share tips, blah, 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 blah. This year has been the busiest flu season I've seen since COVID, stated a doctor over there. Okay, you have to understand something. And they're not going to mention this in here, but I'm going to mention it. Hawaii got hit really hard with COVID last summer. You remember, I remember, longtime followers of the channel who were watching my videos last summer will recall Hawaii got hit really hard. What's one thing COVID can do? Aha, you probably are thinking about it. Maybe you're not. COVID can damage the immune system. Weakened immune system, you can catch a virus more easy. Or something that could have been mild prior to you having COVID, maybe a little bit more moderate or severe. Well, guess what? That's why, one of the reasons why Hawaii could be getting hit so hard at this time. All right, in Hungary, record number of Hungarians in the hospital with severe acute respiratory infections. Yes, they are dealing with a real big rush in patients in Hungary as well. Things are not going well there, and I can tell you this much. The viruses are a big deal over there right now. Moving on now to this. Nebraska health officials find bird flu in Lincoln wastewater. That's right. We've seen this from time to time before, where bird flu does show up in wastewater, and it's been happening since, we'll say, about early last year. So this is something that we will have to keep our eyes on. Speaking of bird flu, in Pittsburgh, they are seeing businesses are being affected by bird flu, and you're probably wondering how. Restaurants. You go to a place that serves breakfast, or you go to a diner, even a place that serves dinner or whatnot. They have to use eggs, and the price of eggs are up big time. Get this, the Consumer Price Index shows an average 65% increase year over year for December. That's for a dozen large grade A eggs. You know what? That's a big cost. And when the price of eggs go up, unfortunately, in many cases, they have to pass that down to the consumer or to the customer, the patron at the restaurant. So this is a problem that is likely going to spread and continue because, as of right now, we're not doing a very good job of containing bird flu. So expect to see the price of eggs continue to go up in more and more places. Taking a look at this now. Measles case reported in Alaska from Seattle flight, and this could have potentially exposed many people, maybe as much as hundreds or even thousands of people. So this is something that is not good. We will keep our eyes on this. There have been a few bits and pieces of measles cases popping up lately. I do believe Canada has had a few cases lately that we reported on. I guess it was about a week ago now. So we'll keep an eye on this. Any news story you see today will make it over to my website, datareport.info. You can see yesterday we did a thread for the news stories, and we'll do one again today. I'll probably get it out maybe this evening. It's not going to be right away. All right, taking a look at the viral activity levels in Canada, and let's see. That should have potentially updated today. And COVID-19 is moderate, flu A is high, flu B is low, and RSV is listed at high at this time. In case you did not see the update from the UK yesterday, they reported another 918 cases. That was down slightly for COVID. This is COVID we're talking about now. And deaths, they went up by 36, or 67.8%. And some people are going to make you focus, hey, 67.8% or 0.9%, and put a scary article. Well, that totals out to a total of 89 deaths. So, yes, they went up, but remember, healthcare is dropping, cases are dropping, deaths lag healthcare. So if you see one of those scary articles, I would be shocked if there isn't one out there. Just note that deaths do lag, and we could see deaths go back down again next week, or within the next week or two. So healthcare, 892 people admitted, but hey, that's down by 114. So it is not all bad in the UK. It's actually, they aren't doing that bad right now when it comes to COVID. And if we go take a look at flu in the UK, flu is really peaked. It is dropping. Take a look at this chart. Flu is really starting to drop now, and this goes across all ages. So some good news out of the UK. Taking a look at air qualities in the United States today, and we will see that there are still some problematic areas. The West Coast and the Northeast, wildfires in the West, fireplace season continues. I suspect next week we're going to see really bad air quality in the East. It's just my guess. It is going to be extremely cold in the East next week, and I got to tell you about that. Let's pause for a second. Anywhere from the Southeast into the Northeast, into the upper Midwest, really anywhere east of the Rocky Mountains, it's going to be very cold next week. In some cases, the coldest air in many, many years. Schools, recess may get canceled next week. It's going to be too dangerously cold for kids to go outside. I mean, you may have highs at or below 0 in some portions of the Great Lakes next week. Recess won't happen. That means kids won't be able to get that fresh air. People will be cooped up inside. Could cause an increase in the spread of these respiratory viruses. Something we got to keep an eye on for next week. Taking a look at what's going on in Pinellas County, Florida, and oh my, they are dealing with a lot of calls at the moment. I'm seeing 1, 2, 3, 4 sick person calls. I'm seeing multiple breathing. 1, 2, 3, 4, 5 breathing problem calls. So not good to see those type of calls. That usually means potentially a respiratory virus of some sort. And for some areas, sick person sometimes is the miscellaneous call, but that's a lot of breathing problem calls at this time. Let's see what Philadelphia reported yesterday. Apologies, I forgot to put this up there. And 734 EMS incidents yesterday. That is much better than Wednesday's count of 860. So Thursday, better than Wednesday. Let's take a look at what's going on in Montgomery County, Pennsylvania right now, and not bad. Just 9 calls. That is something I'm happy to see. Hopefully Chester County will not be too bad. And this is pretty busy for Chester County, Pennsylvania. Both Montgomery and Chester County, Pennsylvania, just outside of Philadelphia. And we can see here, respiratory emergency showing up several times, falls, and a whole bunch of other things. Just a general mixed bag of the calls today. Taking a look at what's going on with the hospital situation in Pennsylvania. And you know what? Though I have to refresh this. I was going to say this is the best it has looked in a while. Maybe I might want to hold off on saying that because it's York, Pennsylvania, emergency department overcrowding. Emergency department overcrowding at, where is this? This is Paoli Hospital. Or what would be Paoli Hospital. Wow. Yeah, that is a lot of, yeah, things are pretty busy in southeast Pennsylvania. Let's go up closer to the Lehigh Valley. Emergency department at capacity at St. Luke's, Bucks in Quakertown, Pennsylvania. Behavioral health diversions are showing up in Lehigh Valley. That's never a good thing. And we're also seeing, yeah, it's busy. And keep an eye on the Poconos. It is a 3-day weekend. The emergency department could be busy there this weekend. It's a busy ski weekend. Taking a look at New Jersey, and hopefully New Jersey will not be too bad, because New Jersey has been trending better. And so far I'm seeing 1, 2, 3, 4, just 4 hospitals with issues in New Jersey at this time. So that is actually, Terrell Cooper University is doing a full in. It even says total divert. Taking a look at Pennsylvania wastewater, and we do see things are starting to improve in Pennsylvania. We're starting to see decreases. We're starting to see no changes. And the only place that is still on the map showing an increase is Center County, Pennsylvania. And that's because Penn State University just came back from their holiday break. So, yeah, that could increase the spread a little bit. And there are a few charts that if you look at them individually, you will see some increases, but not as high as the peaks. So, overall, at the moment, Pennsylvania has peaked. Taking a look at Walgreens, the COVID positivity rate was 13.2% this week. All right, skipping over wastewater scan today because we do need to take a look at CDC data. And here is the national, I do believe this is for COVID. Yes, national CDC update for COVID wastewater. It's listed at high, but take a look here. All regions of the United States are now dropping. The Midwest has finally peaked and is dropping. The Northeast, the South. Although the South is not dropping all that fast, they have started to drop. And even the West is starting to drop at this time. Remember, the West did not see a big wave fact, the West only made it up to moderate, while the Midwest made it all the way up to very high, and they have dropped back down to the high category at this time. Take a look at this. Here is the CDC influenza-like illness activity level. And you can see here, we're going to reverse this for a second. You can see here, take a look. It is starting to improve. And you're probably thinking, well, that's fantastic. It is. It's not making 100% bit of sense to me, and I'll show you why in a moment when we get to epidemic status. Because while it's showing improving here, epidemic status, at least for influenza, is showing a different story. And the good news this week is nowhere is in purple anymore. We still do have some very high levels, though. New York City, South Carolina, Tennessee, New Mexico, still coming up at that middle level of very high. Then we do have Georgia, Alabama, Louisiana, New Jersey, California, and Oregon still listed at very high. Then we do have a bunch of states, and we're not going to list them all, that are in the high category. So there is still some work to be done. Good to see this peaking. I hope it's correct. First off, before we get to that epidemic status, I do want to show you this. COVID emergency department visits have clearly peaked and are now dropping. That is some really good news to report. But now we come to this. Remember, I just showed you the influenza-like illness map. Here it is again. Has improved. But then you see, wait a second. What's this? Yeah, not making any sense here. There are several states for influenza that is actually growing or likely growing on the CDC map. And this did just update today. It says as of January 14th, which a few days ago. Data will always be a couple days behind. But yeah, not making much sense to me. We have New Jersey, which is growing. We have Wisconsin, South Carolina, Georgia, Florida, Mississippi, Louisiana, Texas, California, all back into the growing phase. And then we have likely growing would be Massachusetts, New York, Tennessee, Illinois, Iowa, North Dakota, South Dakota, Oklahoma, New Mexico, Idaho, and Washington. But we are declining now in Nevada, well, likely declining in Nevada, Kansas, and Nebraska, and Delaware at this time, and it definitely is declining in the state of West Virginia, Kentucky, and Alaska at this time. So, I don't know. Seeing two different things here from the CDC. Just really weird that it ended up like that. Taking a look at the wastewater map for COVID again, we can see the highest areas of orange and red is clearly in the Northeast and the Midwest at this time. Ohio has a lot of work to be done. And let's refresh this just to make sure that this is up to date. I'm pretty sure it is. But you get the point here. Places in the Great Lakes still have some work to be done. Well, are we going to get this back? Okay, yes. Nationally, we are still listed high. We can see just now starting to drop on this map as of the 11th. Again, this page is a little bit more behind and lagged, but you can see the Great Lakes are the worst. And Maine does have some, that 95 corridor from D.C. on up to Maine. Definitely some work needing to be done there. Alrighty, drum roll please. We do have an update from the CDC in terms of COVID variants. And here we go. The XEC variant, and I need to refresh this, I believe is now at 47%. LP.8.1 is now up to 15%. So LP 8.1, it's not high enough yet to cause things to go back up once again, but nonetheless, it is increasing. KP 3.1.1 is at 14%. MC 10.1 is now at 5%. If I had to guess, the next variant that may try to outcompete XEC at some point could be LP 8.1 unless something else pops up. I will be keeping my eyes on this MC 10.1 as well. And if you recall, KP 3.1.1 was the variant in charge before XEC. I think we got to go back to last year for when that was the case. So yes, there is your variant update for this week. New York State today, 1,388 new cases reported. We can see here, while they are still dropped, they're not really dropped. They just had a little bump in the road. Eventually, I think they will start going back down once again. Hospitalizations continue to drop in New York State. 875 people hospitalized and 93 people in the ICU at this time. Alrighty, folks, that does it for today's virus update. We'll take a look at some more individual states and cities tomorrow. We'll look at LA tomorrow, California tomorrow. Video would run too long if we did all of that today, and who knows what tomorrow's news day will be like. If you enjoyed this video, give it a thumbs up. Let's try for 200 like button hits today. Subscribe if you're new to the channel. Trying for 10,000 subscribers this year. The more people I keep informed, the better. And of course, share this video with anyone you know. Leave your comments down below. Hit that notification bell. I will see you guys all again tomorrow. Until I see you again tomorrow, stay safe, everyone, and have a fantastic Friday afternoon. Thanks for watching.